Hello, I'm David Sweanor. I'm chair of the advisory board for the Center for Health Law, Policy, and Ethics here at the University of Ottawa. And I was the first lawyer in the world to work full-time on policy measures to reduce the carnage of cigarette smoking. And the reason for that is that finding out why people are getting ill is a medical scientific question. Dealing with it is a social, legal, political question. And I've been very successful for over 40 years on policies that pragmatically change laws in ways that change behavior, in ways that improve health by reducing cigarette smoking, reducing the use of an incredibly deadly product. And I've had many trips to India, and I'm very concerned about the approach India has now taken on banning the least hazardous products. Bans generally do not work. People find ways around it. Markets find ways around it. But the idea of banning the very low-risk product while leaving widely available the really lethal product is just bad policy. It's not empowering people. It's punishing people who have a dependency on nicotine. So we can do better. We can look at the actual research that's there. We can cut through a lot of the nonsense that's being said about products by people who either are pro-cigarette or are just anti any form of nicotine, in which case they're doing things that are pro-cigarette. We can listen to credible authorities like the Royal College of Physicians in the UK, the most prestigious medical body in the world, that vaping products are a tiny fraction of the risk of cigarette smoking from just everything we know from all of the science. And we have the ability to fundamentally change the course of public health history. And in a country like India, with over 1 million deaths a year, with over a quarter of all the people in the world who are using toxic tobacco products, to get rid of those products by being able to have low-risk alternatives and by encouraging innovation in ever less hazardous, less addictive products, we have the ability to make a difference that's on par with things like eradicating smallpox or polio or dealing with malaria. This is huge. Cigarette smoking is the leading cause of preventable death in the world. And it's killing people, not because they're using nicotine, but because cigarettes or things like some of the very toxic smokeless products available in India are really deadly delivery systems. It's the toxicity in the delivery. And we can deal with that. We have products that can deal with that already. We could have better products. We could work with technology. We could work with consumers. We could do things that pursue public health principles and human rights, consumer rights, and pay attention to the science. We should do that. Thank you.